All right, guys, it is a Wednesday. Been really crazy this last few days, and I think it's just getting into the fall and ragweed and all that kind of good stuff. But what we're going to talk about today on our live stream today, we're going to talk about hot flashes, something near and dear to my heart because I've been having hot flashes for a number of years. They've gotten a little bit less, but I've done some things to help with that. So what I want to do is talk a little bit about what a hot flash is, why do we get them, what are some things that we can do to not, I don't know about prevention, but there are some things we can do to prevent them from becoming really severe, and ways that we can help ourselves through that process. And so hot flashes are most common in menopause and perimenopause. They can be also postmenopausal, so it can be a number of years, and more than 2/3 of North American women experience hot flashes. So that's a lot. And it's not only age related, but it can also be for women who've have had to go on chemotherapy or surgery and had their ovaries removed even at an earlier age. They will go through or enter menopause earlier than 40s, 50s of years of age. And so first of all, I want you to let me know that you're here in the group, and I'm going to be asking some questions. So hopefully you can put in the comments some of your answers, because I want to ask you some idea or some questions about your experiences with hot flashes, and maybe some things and remedies that you've done to help you through those hot flashes. So let's first talk about what is a hot flash, right? So most of you know it's that sudden feeling of overwhelming warmth, right? It just like it starts from your toes and it goes all the way up into your face. Your face becomes flushed. You actually start to sweat. And hot flashes start when those blood vessels near the skin surface start to widen and cool off. And then you break out in a sweat, right? Sometimes you have a rapid heart rate. And then as the hot flash winds down and you're is in a sense cooling off, if you will, you start to get cold, right? And so you start to chill, and that doesn't feel very good at all. So you can also get them at night, and those are nasty, right? We call those night sweats. And so some of the symptoms that you have during a hot flash is, of course, the sudden feeling of warmth, the rapid heart rate, the perspiration. It's mostly in your upper body. If you've really thought that out, sometimes you might not think about it, but because you just feel so overwhelmed with it. And then as that hot flash lets up again, it's that chilliness that you feel, and you may also feel anxious. I know when I was a nurse manager in a clinic, anytime I had to have a difficult conversation, or just going into a meeting that I was running, I would get really anxious, and then I would get a hot flash, or get a hot flash and then I'd get really anxious. And so the frequency and the intensity of hot flashes vary among women, and it can be different. Sometimes they last a minute, sometimes they last 2 minutes, and sometimes as long as 5 minutes. I'd like to hear from you guys, like, how long do you think your hot flashes have been? Like, what is like the longest time that you've experienced that hot flash? Like for me, sometimes it's been minutes. Now as I've gotten older, it's not as long. They're maybe 30 seconds to a minute, something like that. They can be mild, like just kind of a fleeting warmth, or it can be so intense that it disrupts like your daily activities, and that's stressful, very stressful, and provokes anxiety. And they can happen any time. They can happen during the day, they can happen at night. They can wake you up from sleep, and so that's why a lot of times it disrupts your sleep, and you're not getting the sleep that you need, right? And that's hard, and it can cause long-term sleep disruptions. And so how do you manage that? So first of all, when you need to see a doctor, I get asked that a lot, as far as having hot flashes. When they are starting to affect your daily activities, like they're happening frequently, they are disrupting your sleep, consider seeing a doctor and talk about options for treatments. And we're going to get into what some of those options. Hey Kelly, nice to see you, and Jody. I love having you here as well. I did ask a question. I want to know how long your longest hot flash was, do you think? It can be anywhere from like 30 seconds all the way up to 5 minutes. And are you still experiencing those hot flashes? As you get older, they tend to go away. Or maybe not go away necessarily, but they do subside, and eventually they do go away. So not all women, though, that go through menopause have hot flashes. And it's not clear why some do and some don't. But there are some risk factors, and the risk factors are smoking. So women who smoke are more likely to get hot flashes. I don't smoke, I've gotten hot flashes, but that is a risk factor. Obesity. So if you have a high body mass index, so that's that BMI, that number that you want to be less than 30, that is associated with a higher frequency of hot flashes if you're obese. And your race, what your race is. So more black women report having hot flashes during menopause more than any other women of other races. They are reported less frequently in Asian women. So interesting how that might be a risk factor. Complications, right? It's the sleep. It's really the sleep that's very disruptive, or like having a difficult conversation with somebody and you get that hot flash, or you're in a meeting and you're leading this meeting and you have this hot flash. Sometimes it just causes that concentration that you have from going, it just goes away. It's really, really hard. Hey Jody, thanks for replying. So 30 seconds. I've had some that have lasted like minutes. That's crazy, isn't it, when you talk about hot flash? So how long were you going to have them? So how long is the onset to ending? Like, when are these going to go away for good? And that depends. Some don't ever get them, like I said. Others have them for a very short period of time, and still others can have them for 11 years or more. On average, though, from the studies that I've read, hot flashes and night sweats last about 7 years. So my mom told me, just wait till you have hot flashes, because I had them for 17 years. And I'm thinking to myself, I'm not going to have them for 17 years. That's crazy, right? It is crazy. So there's really nothing you can do to avoid them from happening around menopause. If you're one of those 2 out of 10 women get hot flashes, there are some triggers that can make them more frequent or more severe. So some of the triggers, stress. So when I talk to you guys about like doing a presentation or having difficult conversation with an employee, and those kinds of things, that's stressful, right? And so that would bring out a hot flash for me. And then I'd lose concentration, and I felt like, oh my gosh, I felt like a hot mess. No pun intended. But another trigger is caffeine. So stress, caffeine, alcohol. I notice red wine will bring on more hot flashes at night for me. If I have a glass of wine with dinner, typically red wine, I guarantee I will have some type of hot flash during the night. Spicy foods, right? So it's the dilation of blood vessels. So hot flashes happen when the blood vessels close to your skin start to open up, so they dilate. So that's the wine, that's the spicy food. So if you really like spicy foods, you might have a few more. If you wear really tight clothing, like you have a sweater on that's snug, or like you've got something zipped up, you know how when you have that hot flash, you gotta like unzip it and take it off, and like that can cause a trigger for a hot flash. Heat. So Dorothy, you were talking about the heat, and we had this in the Midwest. We had this heat index, not this week, but last week and the week before. That was just like over 100, and it was humid. And Dorothy was saying that she was having so many more hot flashes. Heat is a trigger. So when you add, and cigarette smoke. So if you're around somebody who smokes, or you smoke yourself, is a trigger. So interesting. So the triggers are stress, which we all have. Caffeine, we probably drink coffee, right, or tea. Alcohol, spicy foods, tight clothing, heat, and cigarette smoke. So if you're more prone to environments that have that, those are triggers you're going to have more frequent and maybe more severe hot flashes. So let me read some comments. Dorothy, I can't think when they hit, and if they are bad, I struggle for a few hours after. Yeah, there can be very debilitating, right? Because some women have a rapid heart rate with it, and you just get flushed, and then you get cold, and you're uncomfortable, and it just takes forever, right? Yeah, Kelly, sometimes the tops of my feet sweat. Oh my gosh. Yeah, that's a whole body experience. And Dorothy, you're on about year 6. Well, hopefully you're in one of those that just average 7, right? I know. Jennifer, thankfully I don't get them anymore now that I've been Yes, they were awful. So it's good to know that you go away. So thanks for sharing. Stress, Angie McDonald, stress and sugars trigger. Yep. Like I said, spicy foods, definitely. So sugar causes inflammation. Again, inflammation dilates blood vessels, right? So that's probably a trigger, definitely. Yeah, I know you said you were dying nonstop with the heat. I know I had a lot at that time too. So, yes, I wish I was one of those, women that didn't get them. I don't. Most of the women that I talk to do experience hot flashes, and I know I have some friends who've had to have total hysterectomies that have gone through menopause at an early age, and the struggles that they've had too. So it's not just us that are a little bit older. So good, Jody, it's good. And sometimes, when you said yours have gotten much better, it's about the foods we eat too. So if we're eating foods that don't cause inflammation and don't add spice and don't cause, bloating and things like that, that will tend to decrease those. I know when I eat a little bit more clean, then I don't experience them as much. So it does make a difference as to what you put in your body too, and that's important. So how do we treat that? So the most effective way to relieve the discomfort of hot flashes is to take estrogen, but of course that carries some risks, and it's not always appropriate if you've had cancer or you have other conditions in which the doctor does not want you to take hormones. But what they say is taking the estrogen within 10 years of your last menstrual cycle or before the age of 60, the benefits can be greater than the risk. So think about that. Listen to this. Now, this was new to me. I didn't know this, but medications such as antidepressants and anti-seizure drugs also might help reduce hot flashes, but they're less effective than hormones. And I'm not a big proponent of just taking medicines like drugs, because those in itself have side effects. But these are some of the treatment options. So you want to discuss those pros and cons with your doctor. If if hot flashes don't interfere with your life, you don't need the treatment. You probably don't. Because they do subside without treatment, but it does take a while, right? So let's talk a little bit about hormone therapy. I am going to talk about things that you can do aside from medications, because like I said, I am not a pill pusher. They have risks in itself, especially when you talk about antidepressants. But hormone therapy is a primary hormone used to reduce the hot flashes. Most women who have had a hysterectomy can take estrogen alone, but if you still have a uterus, you should take progesterone with the estrogen to protect against cancer of the lining of that uterus. So that's important that you take those two together. But the therapy has to be tailored to your needs, so you have to be under obviously a physician's a physician's care for that. So you want to use the smallest effective dose for symptom control. And as long as the goal is really to optimize your quality of life. It's like for me, they were really unbearable. So I will tell you that I do take estrogen and progesterone, and it's helped immensely. So I can speak to that, and if you guys have questions about that, I'd be more than happy to share who I work with and what I recommend as far as that. But it's not for everybody, and I'm not saying it's for you, but it is a thought. So Dorothy, I'm not sure about a test. I think it's just going to vary from woman to woman when they stop. What we can do is control them in some ways, and one is the hormone therapy. So that's something that you want to talk to a physician about, right? So antidepressants, I really that is a treatment option. That's something that would refer you to a physician to describe, but that is an option as well, but not as effective as hormone therapy. There are other prescription medications that offer some relief for women. Gabapentin is one. Lyrica is another one. Oxybutynin, which is ditropan, and ditropan is used for bladder spasms and urinary incontinence. And so some of the women I talk to are on things like that, and that does help with hot flashes. And then clonidine, or something called Catapress, and that treats high blood pressure. But unless you are on that for those medications for something else, I don't recommend you take an additional medication, because anything that you take passes through your liver and your kidneys. So I would want you to talk to your physician. What I'm doing is just telling you some of those treatment options. The biggest thing, as far as if you want to go the medication route, would be hormone therapy, but you still have to be under guidance from a physician's assistant, nurse practitioner. So if that makes sense. Thank you for all your comments, and I'm looking forward to not having them again either. So here are some options that aren't medication related. Stay cool. Right? So obviously when it's so blasted hot out, stay in air conditioning, stay as cool as you possibly can. You can get like a chill pillow, they call it, where you can fill it with water and cool, and you can put it around your neck, like if you're working on a computer, to stay cool. You can use a fan during the day. I always have a fan on at night. It not only helps me sleep, but it does help with decreasing that waking up and sweating. It just, the way the breeze comes in, it's a cooler. Wear light fit clothing. You can practice deep breathing. So meditation is a way. So slow abdominal breathing, 6 to 8 breaths per minute, so nice and slow. I kind of relate that to when my kids were little, and I would say I'm counting to 10, or I'd have to just count to 10 in a room all by myself. And that's kind of what I do now. I just take some slow, deep breaths to just kind of relax me, take some of the stress away that I might be feeling that might have brought on that hot flash. So those are some things you can do that aren't medication related. Again, here's something that exercise will help. Exercise daily, walking, swimming, bicycling, just staying active, lifting weights, losing weight, eating well, all of that kind of stuff. You can also do plant estrogens that are found in soy products. They're weak estrogen-like effects, but still can help cut the hot flash intensity and the number that you might be getting. You can get soy from tofu, edamame, which is really delicious. Edamame is a very good, like a vegetable. It's like a bean. And tofu you can get pretty much in any store. You can have it cold. You can heat it up. You can saute it. Tofu isn't bad if you saute it with some vegetables. That will help you get some of that soy. Now, if you have risks of cancer and your physician doesn't want you to have estrogen, obviously you would stay away from that. There are some studies that say black cohosh may be helpful for about 6 months or less. And so sometimes those, but that can have its side effects too, and can also affect any other medications you might be on. So you want to check with your doctor about that too. So if these are really bothersome, the hot flashes, and like they were for me, talk to a doctor, right? You can talk to a nurse practitioner. You can talk to a naturopathic doctor. You don't have to go to your general practitioner. You can see your OBGYN. But talking about hormone replacement therapy, it's something that is limited, typically less than 5 years, but it does help with the hot flashes. It can help with other symptoms of menopause besides the hot flash, vaginal dryness, mood swings, that kind of thing. When you stop taking hormone replacement, sometimes those hot flashes can come back. But if you take them for long enough to the point where you get older, you won't need the hormone replacement therapy. And we talked about those prescriptions and things like that. But again, Even though I'm a nurse and I gave medications to patients, I don't believe in taking a pill for everything that bothers you. And so the hormone therapy and just some of those other tips and tricks too, with staying cool, using a fan, staying in air conditioning when it's hot outside, trying to alleviate a little bit of your stress, and that's where exercise, eating well, and stuff come into play. Other things you can do: B vitamins, B complex vitamins, vitamin E. Sometimes ibuprofen helps decrease any swelling that might be going on. But also make sure you're talking to your doctor about your hot flashes and treatment options. So again, stay cool. Open your windows, use your fan. I sleep cool, like it's 66 or 68 degrees with my air conditioning on. When it's cooler outside, the windows are open. Hot and spicy foods cause intensity in your hot flashes. So, and caffeinated beverages, alcohol. So just recognize those triggers. The stress, like we talked about too. Use those mind-body therapies, the meditation, slow, deep breathing, stress management. I'm just looking at my notes here. Don't smoke. That's a big one. Plus, it can cause other issues: heart disease, stroke, cancer, things like that, right? Lose weight. That will help. So we talked about some of the natural products, the plant estrogens. We talked about the black cohosh. Ginseng may help with mood symptoms and some insomnia, not with the hot flashes. Vitamin E, again, and the B complex vitamins. So those are just some things that I've done some research on and work. If you want to know more about hormone replacement therapy, please contact me. Just make a comment below the video or right now, as if you're on. If you guys have any questions, please post your questions. I will take questions. And yeah, hot flashes are not fun. Like I said, 2 out of 10 women experience it, so that's a lot of women, right? It's 2/3 of women. Black women tend to experience more. Asian women experience less for whatever reason. Could be diet related, for sure. Those risk factors, again, the smoking, the caffeine, the stress, the heat, alcohol, all of that. Just be aware of what those triggers might be. And I know, Dorothy, for you it was the hot, and it could be just stress related to your job. I know stress for me was a huge trigger. Wine is a trigger for me, especially red wine. That's a big one. Anybody else have any triggers that set them off? You can post those in the comments. I'd love to hear about that. And also, we know that they do go away. It would be really nice if there was like this blood test that would say, yep, won't be long and you won't get them. Hormones to help with that, because I was totally miserable and not sleeping. I was a crab. And so I needed to do something. And the combination of the estrogen with the progesterone has really, really helped me. It's helped my moods. You can ask my husband about that. And I'm being monitored, frequent lab work, and being monitored by a physician. So, like everything does have side effects. For me, the side effects from progesterone have been better sleep. That's not a bad side effect. And the combination has decreased the hot flashes. Again, stress is a huge trigger for me, and I bet it is for a lot of you. Dorothy, my husband is a trigger because he tries to keep the heat on. Yes. And so my husband will have like a lot of blankets on, and I'm like, bring on the fan, bring on the cool. So yes, your husband's a trigger. I'm not sure what you can do about that. Yeah, and I think it's hard. It's hard for them too to understand, because they don't have hot flashes. They're just trying to like deal with you, right? That's always a tough one. So, yeah, heat's a big one. And so Also, the deep breathing helps as well. So I hope this was helpful. There's so much more to menopause and symptoms, but I wanted to talk about hot flashes because it's near and dear to my heart because I'm still not done with them. Yeah, Corey, I will have to watch this later. This summer was awful. I've been a lot better lately. We've had a really hot summer, and that's been a trigger for most. And then, if you're drinking wine, especially, or adding alcohol, um, not getting rest, that those are all going to just kind of like compile, and they're just going to build and build and build. And there are things that you definitely can do about it. So I'm here as a resource to help you through that the best I can. Try some of those other remedies. I will put some triggers and some um, helpful hints and tips in the comments below the video too, that you guys can refer to. So, well, hopefully you had a great Wednesday here and got something out of our talk about hot flashes and not another hot flash. So you didn't get any hot flashes. So, anyway, I guess I'm trying to be funny, and maybe I'm not. But anyway, so let me know if you have any questions, anything that you need. Please let me know in the comments below. And have a great Wednesday, and we will see you next week. Take care.